If you're a nurse learning English, this matters a lot. Numbers in English seem easy, but medical English has its own rules. In this video, I'll show you how nurses actually say numbers like vital signs and lab values out loud. But first, there are two things you need to understand about numbers in medical English. We don't say slash, dot, or period. We say over and point. Blood pressure is a ratio, so we say over. Decimals are point. And number two, we shorten everything. In nurse-to-nurse communication, extra words are removed. We don't say the patient's heart rate is 101 beats per minute. We say heart rate 101. Don't say 120/80. Say 120 over 80. Other examples, 110/70, 140/90. Never slash. Heart rate 72. You can say heart rate 72 beats per minute, but usually in report, you would just say heart rate 72. Respirations 16. Respirations 16 per minute is okay, but unnecessary. Keep it short, clear, and efficient. Temperature 37.2. Not dot, not period. Always say point for decimals. And this applies to lab values, temperatures, blood sugars, and medication doses. Also, notice I didn't say Celsius. In clinical settings, the unit is understood from context. For example, if I said 99.5, you would know it's Fahrenheit. If I said 37.6, you'd know that it's Celsius. Nurses use their own judgment. The number itself tells you the unit. This is where nurses can sound non-clinical. We don't say 105. We say 105. Other examples, 102, 104, 205, 209. And this rule only applies when there's 1 0 in the middle of 3 digits. We don't say 100, we say 100. We don't say 110, we say 110. We don't say 70, we say 70. We drop 100. We say O, not 0. Notice the difference. 108 sounds slower in textbook, right? 108. Fast, clear, efficient. Now it's your turn. I'll show you a number. You try to say it before me. Ready? Glucose 105. Potassium 3.8. Hemoglobin 11.2. Creatinine 1.1. Blood pressure 130/80. Blood pressure 102/64. Blood pressure 112/70. Blood pressure 102/54. Let's practice how this actually happens in report. I'll show you the value. Think of how you would say it. Blood pressure 118/76. Heart rate 78. Respirations 18. Temperature 37.8. O2 sat 94%. Creatinine 1.2. Potassium 3.9. Hemoglobin 11.1. Glucose 106. If you could easily say those numbers, congratulations, you're thinking in English. That's exactly what I teach inside my Fluent Nurse course. If medical numbers seem confusing, it's not your intelligence and it's not your grammar. Clinical English has its own rhythm, and many nurses are never taught this. That's why Fluent Nurse exists.